The 5 warning signs and symptoms of colon cancer. Colon cancer, also called colorectal cancer, ranks among the top 3 most common cancers worldwide, according to the World Health Organization, WHO. Despite its prevalence, it's one of the few cancers that can often be prevented or fully treated if detected early. This disease typically starts quietly, developing from small, non-cancerous growths known as polyps in the lining of the colon or rectum. Over time, due to genetic mutations in key regulatory genes such as APC, KRAS, and P53, these polyps can transform into malignant tumors. The process is slow, often taking 10 to 15 years, which is why early screening and awareness of subtle symptoms are critical. According to the American Cancer Society, if colon cancer is caught early, when it's still localized, the 5-year survival rate is about 91%. But if diagnosis happens after the cancer spreads to distant organs, survival drops below 15%. This statistic highlights one crucial truth: recognizing early warning signs can literally save lives. Before we begin, please like this video, subscribe, and turn on the notification bell so you never miss important health updates that can protect you and your loved ones. Now let's dive into the 5 early signs and symptoms of colon cancer and uncover the science behind what causes them. Number 5. Persistent changes in bowel habits. Your digestive system functions like a precision machine, and your bowel habits are one of the first indicators when something's wrong. Persistent diarrhea, constipation, or changes in stool shape or consistency can signal more than just dietary upset. They can be early markers of colon cancer. When abnormal cells begin forming polyps or tumors inside the colon, they can obstruct the intestinal passage, irritate the mucosal lining, or alter the way your intestines absorb water and nutrients. These mechanical and biochemical changes disrupt normal bowel rhythm, leading to alternating diarrhea and constipation. Diarrhea occurs when tumors secrete inflammatory cytokines such as IL-6 and TNF-alpha, which increase intestinal fluid secretion and reduce water reabsorption. Constipation, on the other hand, happens when a tumor narrows the lumen of the colon, slowing the passage of stool. Some people notice ribbon-like or pencil-thin stools, a sign that the tumor may be partially blocking the rectum. A study published in the New England Journal of Medicine found that persistent alterations in bowel habits, particularly when unexplained by diet or lifestyle, were strongly correlated with underlying colorectal neoplasms, meaning polyps or early-stage tumors. One particularly telling sign is tenesmus, that uncomfortable feeling of still needing to pass stool even after going to the bathroom. This happens because a tumor in the rectum interferes with the nerve endings responsible for signaling bowel completion. Essentially, the body thinks there's still stool to expel when it's actually the mass pressing against rectal walls. A 2021 review published in the British Medical Journal, BMJ, noted that individuals reporting persistent bowel habit changes lasting more than 3 weeks had a significantly higher chance of detecting precancerous or cancerous lesions during colonoscopy. Although dietary shifts, stress, or infections can also alter bowel habits, persistence is the key red flag. Colon cancer symptoms don't come and go quickly. They tend to linger or progressively worsen, often with other subtle signs like bloating, cramping, or fatigue. The colon's main role is to absorb water and electrolytes while compacting waste. When cancer disrupts this system, it not only changes stool patterns but also alters your gut microbiome balance. Emerging research from Harvard Medical School shows that cancer-related inflammation in the colon can change microbial populations, promoting bacteria that further fuel tumor growth, creating a vicious cycle of inflammation and mutation. If you notice any unexplained bowel changes lasting longer than a few weeks, whether it's diarrhea, constipation, or strange stool shapes, don't ignore it. Schedule an appointment with your doctor and request appropriate screening tests, such as colonoscopy, to visually examine the colon and remove suspicious polyps. FIT, fecal immunochemical test, to detect hidden blood in stool. Stool DNA test, Cologuard, to identify abnormal cancer-related DNA. Remember, colon cancer develops silently, but your body often sends quiet signals first. Listening to those signs and acting promptly could prevent a serious outcome. Your gut health is the foundation of your overall wellness. By paying attention to what your digestive system is telling you, you take a powerful step toward early detection, prevention, and longer life. Number 4. Blood in the stool, the hidden warning sign you should never ignore. Blood in your stool, whether it appears as bright red streaks or dark, tarry stools, is one of the most serious warning signs your body can give you. While it can be caused by several benign conditions such as hemorrhoids, anal fissures, or inflammatory bowel disease, it may also indicate something far more serious, colon cancer. When a tumor begins to form inside the colon or rectum, it gradually invades the delicate lining of the intestinal wall. This lining, rich in tiny capillaries and blood vessels, becomes fragile as cancer cells secrete enzymes and inflammatory molecules that erode healthy tissue. As a result, the surface of the tumor can ulcerate and bleed, allowing small amounts of blood to mix with stool as it passes through the colon. The color of the blood actually offers a scientific clue to where the bleeding is coming from. Bright red blood, hematochezia, often signals bleeding from the lower colon or rectum, meaning the blood hasn't had time to break down. Dark tarry stools, melena, suggest the bleeding originated higher up in the digestive tract, where the blood has been partially digested by stomach acid and intestinal enzymes. Researchers have found that tumors in the colon can also release angiogenic factors, substances like vascular endothelial growth factor, VEGF, that stimulate new, fragile blood vessel growth around the tumor. These new vessels tend to rupture easily, contributing to chronic, low-level bleeding that might only be detected through a fecal occult blood test, FOBT, or fecal immunochemical test, FIT, before it becomes visible to the naked eye. A landmark study published in the journal Gut found that rectal bleeding was one of the most common early symptoms reported among patients later diagnosed with colorectal cancer, often preceding other gastrointestinal complaints by several months. This makes it a key diagnostic clue that should never be dismissed. Moreover, ongoing microscopic bleeding can lead to iron deficiency anemia, leaving patients feeling unusually fatigued, pale, or short of breath. This happens because your body loses red blood cells faster than it can replace them, a process confirmed in research from the American Journal of Gastroenterology, which linked unexplained anemia to undiagnosed colorectal tumors in adults over 50. If you notice any form of blood in your stool, don't panic, but don't ignore it either. Even if it seems minor or happens only once, it deserves medical attention. Your doctor may recommend diagnostic procedures such as colonoscopy, to visualize and biopsy suspicious areas, sigmoidoscopy, to inspect the rectum and lower colon, FIT or FOBT tests, to detect trace amounts of blood invisible to the eye. Catching this symptom early can make a life-changing difference. According to the National Cancer Institute, colon cancer detected at an early stage has a 5-year survival rate of over 90%, compared to less than 15% once it spreads to distant organs. Blood in the stool is your body's silent SOS, a message that something inside your digestive system needs immediate attention. Ignoring it or assuming it's just hemorrhoids can delay diagnosis and allow the disease to progress quietly. By listening to your body, acting early, and scheduling the right tests, you give yourself the best chance at early detection, effective treatment, and full recovery. Number 3. Abdominal discomfort or pain, the hidden pressure within. Persistent abdominal pain, cramps, bloating, or a constant feeling of fullness are symptoms that should never be brushed off, especially when they don't resolve with time or lifestyle changes. These sensations may seem ordinary at first, but when they persist, they can sometimes point to a deeper issue, colon cancer. To understand why abdominal pain occurs, we need to look at how the colon functions. The colon, or large intestine, is responsible for absorbing water and electrolytes while compacting waste into stool. When a tumor begins to form along the intestinal wall, it can obstruct the normal flow of stool through the colon, leading to pressure buildup, stretching of the intestinal wall, and spasms of the surrounding muscles. This mechanical blockage often stimulates the visceral nerves, the sensory nerves in the gut that detect distension and pain. As the tumor grows, it can also trigger inflammation in the surrounding tissues by releasing cytokines and pro-inflammatory molecules such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha. These chemicals not only irritate local nerves, but can also amplify pain perception throughout the abdomen. In some cases, cancerous growths may even press against nearby organs, such as the bladder or small intestine, causing referred pain that radiates across the abdomen or lower back. That's why colon-related pain can feel diffuse and hard to pinpoint, often described as dull, cramp-like, or accompanied by bloating and gas. A large study published in the Journal of Clinical Oncology found that abdominal discomfort was one of the most frequently reported early symptoms among patients later diagnosed with colorectal cancer. Researchers noted that this pain often began months before diagnosis, suggesting it is one of the earliest internal warning signs the body gives. Further studies have shown that the location of the tumor can affect the type of discomfort experienced. Right-sided colon cancers, near the ascending colon, tend to cause vague, persistent pain and bloating because the stool here is still semi-liquid and the colon has a wider diameter, making obstructions less obvious. Left-sided colon cancers, near the descending or sigmoid colon, often cause sharp cramps, constipation, and noticeable pressure, as this part of the colon is narrower and the stool is more solid. Additionally, chronic inflammation within the colon alters gut motility and microbiome balance, leading to symptoms like bloating, gas, and irregular bowel patterns. Studies in Nature Reviews Gastroenterology and Hepatology highlight how inflammatory signaling can disturb the gut-brain axis, heightening visceral sensitivity and discomfort. If you experience ongoing abdominal discomfort, especially when combined with bloating, fatigue, or changes in bowel habits, it's important to talk to your healthcare provider. Doctors may recommend imaging tests such as CT scans, colonoscopy, or ultrasound to evaluate structural changes in the colon and surrounding organs. It's also worth noting that while other gastrointestinal conditions like irritable bowel syndrome, IBS, or diverticulitis can cause similar symptoms, these typically fluctuate and improve with diet or stress management. Colon cancer pain, on the other hand, tends to be persistent, progressive, and unresponsive to common remedies. Your abdomen is not just a digestive hub, it's a sensitive communication system. When something feels off and stays that way, your body may be trying to signal internal obstruction, inflammation, or tumor growth. Ignoring this discomfort could mean overlooking the earliest stage of a preventable disease. Remember, when detected early, colon cancer is one of the most treatable cancers, with survival rates exceeding 90% in localized cases, according to the American Cancer Society. So if persistent abdominal pain is part of your daily life, don't normalize it, investigate it. Early medical evaluation could mean the difference between simple treatment and a life-altering diagnosis. Number 2, unexplained weight loss, when the body's balance shifts. Weight loss can be a positive goal when it's intentional, but when it happens without any change in diet, exercise, or lifestyle, it becomes a critical red flag. Unexplained weight loss, defined medically as losing more than 5% of your body weight within 6 to 12 months, is one of the most overlooked warning signs of underlying disease, including colon cancer. When colon cancer begins to develop, it doesn't just affect one organ. It disrupts your entire metabolic system. Cancer cells have an unusually high energy demand because they multiply rapidly. To fuel their growth, they consume glucose and nutrients at an accelerated rate, essentially hijacking your metabolism. This phenomenon is known as the Warburg effect, a process in which cancer cells favor glycolysis, the breakdown of glucose, even in the presence of oxygen. This inefficient but constant energy use burns calories faster than your body can replenish them, leading to unintended weight loss and muscle wasting. Furthermore, colon cancer releases inflammatory cytokines such as IL-6, TNF-alpha, and interferon gamma into the bloodstream. These chemicals alter appetite-regulating hormones like leptin and ghrelin, resulting in reduced hunger and early satiety. You simply don't feel like eating. At the same time, chronic inflammation increases basal metabolic rate, forcing your body to burn more calories even at rest. A landmark study published in Cancer Epidemiology, Biomarkers and Prevention found that individuals over 50 who experienced unintentional weight loss had a significantly higher likelihood of developing colorectal cancer within the following year. This finding reinforces the importance of treating unexplained weight loss as a clinical red flag, not a coincidence. If you're losing weight without trying, your body is signaling a systemic imbalance, a tug-of-war between nutrient intake and metabolic demand. This can result in muscle breakdown, nutrient deficiencies, and fatigue, as your body prioritizes energy for vital organs rather than normal functions. It's vital to consult a healthcare provider for evaluation, which may include blood tests, stool tests, or colonoscopy to rule out colorectal or other systemic conditions. While unexplained weight loss can stem from thyroid issues, diabetes, or gastrointestinal disorders, it should never be ignored, especially if accompanied by changes in bowel habits or abdominal discomfort. Number 1. Fatigue and weakness, the body's silent cry for energy. Feeling constantly tired, weak, or drained, even after getting enough rest, can be more than just a sign of aging or stress. In some cases, persistent fatigue is one of the body's earliest responses to colon cancer. Fatigue in colon cancer arises from several intertwined mechanisms. First, cancer-related bleeding, sometimes microscopic and invisible to the eye, can lead to iron deficiency anemia. The colon's delicate blood vessels may leak small amounts of blood over time, reducing red blood cell count and limiting oxygen delivery to tissues. When your muscles and brain receive less oxygen, they struggle to produce energy efficiently, resulting in chronic fatigue and weakness. Secondly, colon cancer can disrupt nutrient absorption. The colon and small intestine are responsible for absorbing water, electrolytes, and certain vitamins. When tumor growth interferes with these functions, your body receives fewer nutrients, leaving you depleted even if you eat normally. Inflammation also plays a role. The body's immune system releases pro-inflammatory molecules, such as C-reactive protein, CRP, and IL-1 beta, to fight the tumor. But this persistent inflammatory state drains the body's energy reserves, redirecting nutrients toward immune defense instead of daily function. A study in the Journal of Pain and Symptom Management found that fatigue was among the most common and burdensome symptoms reported by colorectal cancer patients, even before diagnosis. Researchers noted that this fatigue often appeared months earlier than other clinical symptoms, suggesting it may serve as an early systemic warning sign. Cancer-related fatigue is not just about feeling sleepy, it's a biochemical exhaustion. Your body's mitochondria, the tiny energy-producing factories in every cell, become impaired by inflammatory stress and oxidative damage. As a result, even simple activities like walking or cooking can feel overwhelming. In addition, colon cancer may affect the gut-brain axis, altering neurotransmitter levels such as serotonin and dopamine, which regulate both energy and mood. This is why many individuals with undiagnosed colon cancer also report low motivation, mental fog, or mild depression, not realizing these could be connected to systemic illness. Fatigue and weakness that persist despite rest are not signs to push through. They are your body's signal that something deeper is draining your strength, possibly anemia, inflammation, or nutrient loss linked to colon dysfunction. Ignoring them can allow disease to progress silently. Early testing, such as CBC complete blood count, for anemia and colonoscopy for structural abnormalities, can help detect colon cancer before it spreads, when treatment success rates exceed 90% for localized cases. By recognizing the key signs, persistent bowel changes, blood in stool, abdominal pain, unexplained weight loss, and constant fatigue, you give yourself the best chance for early detection and survival. Colon cancer caught early is highly treatable, but ignored symptoms can allow it to advance silently. If any of these signs sound familiar, don't delay. Schedule a medical checkup today. And if you found this video helpful, please like, share, and subscribe to help us spread awareness. Together, we can empower more people to detect colon cancer early, protect their health, and live stronger, longer lives. Thank you for watching, and I'll see you in the next video.